challenge, contributing to both maternal and child mortality, perpetuating a harmful cycle of poor health and poverty. Now, according to the recent demographic health survey, nearly 1 in 4 teenage girls in Zimbabwe has fallen pregnant. The report noted that teenage pregnancy is more prevalent in rural areas as compared to urban areas. 21,000 teenage girls in Matabeleland North alone became pregnant in just over 2 years. What do the numbers tell us about the state of sexual and reproductive health here in Zimbabwe? What are the major causes of teenage pregnancies, and what are the impacts of these teenage pregnancies? What interventions are in place in order to prevent this? And the most important question, are they working? Our discussion on The Chase today, teen pregnancies in Zimbabwe, a growing crisis. To explore these issues and more, I am joined in studio today by Miranda Tabifor, Country Representative, United Nations Population Fund, popularly known as the UNFPA. We also have Mucham Kamuri, Chairperson, Women's Coalition of Zimbabwe. We have Jimmy Wilford, Executive Director of Say What. Joining us via the phone is Tonga Nandoro, Director of Communications and Advocacy from the Ministry of Education. And over Zoom, we are joined by Sifile Pelo Sibata, Project Coordinator, Rise and Shine Trust, that is based in Matabeleland North. Ladies and gentlemen, welcome to The Chase.
Thank you.
Thank you.
And for my guests joining us via Zoom and the phone, thank you so much for joining us.
You're welcome. Thank you.
Now, please note that all views expressed on The Chase are those of our guests and do not reflect the views of St. Papers 1980 or those of ZT and Prime. Let's cut straight to The Chase. Now, the recent health survey, especially on teenage pregnancies, has raised a very high concern, with most stakeholders expressing shock at the number of teenagers that are falling pregnant. How are we interpreting this data, and what does it reveal about adolescents' health, reproductive health in Zimbabwe? Do we seem to have a growing crisis here on our hands? I'll start with you, Miranda.
Thank you so much for having me as a UNFPA representative. I would like, first of all, to applaud the statistics, because without the statistics, which we see as an opportunity, we cannot address the challenge. The Zimbabwe Demographic Health Survey that was recently released, we appreciate the government of Zimbabwe that we partnered with other partners, Zimstad, to work to reveal those results. Those are accurate results. And those results, for us, as the United Nations Sexual and Reproductive Health Agency, is a concern, because these are girls who are expected to have and live their full potential, but they are pregnant. So when these results were released, because they're building actually on a study that was conducted in 2023 by the government of Zimbabwe, Ministry of Public Service, supported by the United Nations entities like UNFPA, UNICEF, UNESCO, and now the DHS has come to consolidate and confirm those results. We realize that from these results, it is something that is a crisis. The way we have actually packaged it is a crisis, and it's a huge concern for us when we look at the sexual and reproductive health status of the young girls. What does this mean for us? That report says that nationally, 23.7% of the girls, they have actually experienced teenage pregnancy in Zimbabwe. And then when we did an analysis going at the sub-national level, that's where we are coming to have issues where there is increase more in Matabeleland North and the rest. I'm happy to have our other panelists there. So for us, as I did mention, it's a concern. But we are also happy because we can now collectively put in place targeted interventions to address the issues. Or reinforce what we're already doing. What are we doing already with regards to this before the DHS came to confirm that? We have, as UNFPA, working with the government through our respective country program cycles. The current one is the 8-country program, where our program has this huge topical issue or outcome area that will focus on the adolescent health of the young people. So focusing on that, we have the girl child. The girl child that is at the center that is having this challenge. And this girl child is faced with the teenage pregnancy. The girl child is not only faced with the teenage pregnancy, is also faced with child marriage. The girl child is also faced with HIV and AIDS, because we look at it holistically. So if the teenage pregnancy is emerging as a major crisis, because the report shows that, but it is interlinked. So we look at the integrated approach to the challenge that this teenage girl is facing. So when it comes to the exact intervention that we have been doing with the government of Zimbabwe through the Ministry of Health, through the Ministry of Public Service, the Ministry of Primary and Secondary Education, we are in the schools sensitizing them, and I'm happy that Jimmy is also here. We go partner with them to do a lot of work. We are providing information. So information is power. If you don't have information, you cannot address issues that affect you. So our young girls who are supposed to be in school, let's bring it home. Your child is supposed to be in school, but the child is pregnant. So what do? It means that we have to give information to this child to make informed decisions and choices. We should give this girl or this girl child an opportunity to go back to school. That's why in the schools we are having awareness raising programs. Recently, Jimmy will expand on that with the government and the National AIDS Council and the Youth Network. We launched a huge campaign we call Not in My Village. Not in My Village campaign, if you even look at the title, Not in My Village campaign means that we don't want teenage girls to be pregnant in a particular community, in these communities that we have actually mentioned in that report. And the chiefs, the local authorities came together and said, we want to stamp out teenage pregnancy in our communities. And in so doing, we are engaging in massive community mobilization with the support and leadership of the adolescent young people themselves. They are leading it and we are always supporting. So as UNFPA, we are seeing this as a challenge, but we also say, okay, this will also help us now to really scale up the interventions that we have so that our adolescent girls who are faced with this challenge, they will be supported. That even though they are pregnant, they should have an opportunity to go back to school. When they give birth to the baby, and I'm very happy, I know that the Minister of Education will talk about that, the approach that the government has is that when this girl is pregnant and gives birth, the girl should have an opportunity to go back to school and be reintegrated in school and in the community. So some of the causes that this report is telling us that has caused teenage pregnancy is poverty. If we look at it's poverty, it's unemployment. Unemployment in the country, I think we know that it's a big issue in the country. So when the adolescent girl doesn't have something to do, the girl is actually exposed to behaviors that actually lead to the teenage pregnancy. Transactional sex, which is something that has been documented in these results, that it is part of the result cause for teenage pregnancy.
Now, Miriam, as we go into the conversation, we are going to also delve deeper into some of those issues that you are raising. But you have posed some from your response, some of the things that you said Jimmy Wolford and his organization have been actively involved in helping you deal with teenage pregnancies. Jimmy, can I just get your take in regards to that?
Well, indeed, when it comes to the factors that possibly might be leading to the crisis that we are discussing, I would want to attribute it to a number of factors, the causes. And when we are looking at the work that we've been doing with the UNFPA, it's more around the information dissemination. The whole idea has been, how can we equip the young people, the teenagers, with the information so that they can make informed decisions. It's not about necessarily only making informed decisions, but again, they can also explore the choices that might be available in regards to their sexual and reproductive health. It's also important for me at this point to highlight that the challenge that we are faced with, the crisis that we are faced with, we are being given an opportunity to really raise a voice where we would call for the parents and the school authorities to find each other. You find that the UNFPA has been supporting work around comprehensive sexuality education. A lot of work has been done around coming up with comprehensive sexuality education mechanism. How are we going to communicate comprehensive sexuality education to to learners within high schools. There has been a crisis in terms of the uptake of comprehensive sexuality strategy, simply because the parents and the authorities did not find each other. So there is a confusion. The parents and the authorities failed to have a point of convergence whereby at what point can we introduce comprehensive sexuality education to the learners? And the failure for the authorities and the parents to agree, in my view, is resulted in us discussing this.
Yeah.
The high figures that we are getting of teenage pregnancies are symptoms of us failing to administer or implement strategies around comprehensive sexuality education that we systematically brought together. And right now, yes, we started talking about age-appropriate conversations, etc. What age? At what level are we doing that? So this crisis that we are faced with, in my view, in my considered view, it's giving us an opportunity to find each other. That there is need for us to dialogue. The parents, the children, the school authorities as well. But the school authorities, what they say, they can buy anyone who is coming in to speak about comprehensive sexuality education, and they might want comprehensive sexuality education to be taught in a way that they want, which might not be effective. So lastly, from me for now, it also, what we are faced with, we might need to rethink our parenting.
Okay, that is such a hot take.
Yes, so we might need to rethink our parenting as a country. We are faced with the reality that technology is developing. We are looking at social media and all other things. So when we are denying the young people correct information in a proper setup, in an education system, etc., these young people these learners are getting such kind of various information from social media, and they are making conclusions, experiments, resulting in us getting these teen pregnancies.
Now, Jimmy, like you say, it's such a hot take. I would like to hear what Miranda says, but before, sorry, Mucha, I apologize. But before we do that, you have mentioned a high statistic. I want to cross over to Yusfe. You are actively involved in Matebele North. 21,000 teenage girls falling pregnant. How do you interpret this data, and is the situation getting out of hand from where you stand and from how you see it?
Thank you so much. What I want to say is that these statistics, they're really a reflection of what has been happening in the last 10 years. And we are only starting to see the picture now. But with grassroots organizations, or as a person who represents a grassroots organization, we've been experiencing these things and we've been seeing them on the ground. And I dare to say that 21,000 is not all that is there. The figure is even higher because these are statistics of people maybe who went to report, who went to antenatal care. But back in the villages and the homes, some of these cases of pregnancies are not being reported. Some of the children are actually aborting, and maybe sometimes parents help, that kind of thing. So the statistic is even higher. It's more so staggering for Mat North because it's above the national average of 23%. We are actually at 25%. So our statistic is scary, it's sobering. More so because we are the second least populous province in the country. We have got about 900,000 people according to the last census. So you can see if you compare to a big province like Harare, our statistics are staggering and are very scary. That's the one thing I want to point out. We've got a crisis that's been building up for the last 10 years, and it's only coming to the fore, and people are willing to talk about it now, but it's been there in the ground boiling up.
Now, this staggering statistics we keep talking about, Muja, your take on this?
I think what Sife said is actually very true, considering that some of the pregnancies happen in the communities. Miranda pointed out that if we don't engage the girl child meaningfully, like if we don't assist her to continue with her education, obviously she's bound to get into doing other things, including sex. And whether we like it or not, as parents, our children slip around. So this way, the older way of doing things is not working. We need to refocus, regroup our thoughts, and agree on the best way forward, considering that We have tried to do prevention strategies, only talking about abstinence maybe, and introducing other methods has not been acceptable. But we need to get a reality check, like what's on the ground right now. We have a crisis, and this is the future generation we are talking about. And we are also talking about closing those taps that are leaking. We need to go back to the drawing table, where we need to start again to draw, discuss, and agree on approaches that can work, possibly even to learn from other countries. How are they doing this? As a country, I know we are socialized in our own way, which we are very proud of, but it has failed us. The state of the situation requires more efforts than ever.
So like Jimmy was saying, rethink our parenting, because that's where it starts. You start by parenting before you send a child to school.
Yeah.
So possibly a reintegration of how we socialize and then the family aspect before we
Yes.
go on to the education spectrum. Speaking of which, Tangana, most of the girls we are talking about are teenage girls, girls who are supposed to be in school. Just now we were talking to Sfe, who was saying the statistics in Matabeleland are staggering and they are very concerning considering the population that is there. You are in Manicaland right now. The province also has contributed significantly to some of these numbers. We have always thought that schools are safe spaces. You don't expect to send a child to school and they come back pregnant. What has gone wrong? Where have we gone wrong, and what do we need to be fixing?
All right. Thank you. Thank you very much for that question. We, as the Ministry of Primary and Secondary Education, we were really deeply concerned about the statistics that are coming up. There are certain factors, however, that we have to realize. Number one, whilst we do have girls that fall pregnant whilst they are in the school system, we do have quite a number of girls who are falling pregnant because they are not in the school system. This is why you then get some of these staggering figures that you are getting, because that girl child is not in school for one reason or another. Most of the reasons have to do with financial insecurity. Others have to do with the home. The home is probably broken. They're living with a single mother or a single father, or they're living with a stepfather or a stepmother. And therefore, they then get to experience that abuse because the home environment itself is very, very toxic. But what are we doing as government? As government this year, through the Ministry of Primary and Secondary Education, we've recently launched the early warning system. Now, the early warning system is there for us to early detect any children with a potential of dropping out of school, in particular the girl child. So our heads of schools, our teachers are being trained throughout the country on how to identify a child who's most likely to drop out of school for a host of reasons, particularly to do with the home setup. Some of them just has to do with lack of school, but lack of interest in school, that lack of interest in school has to do with the environment or the community in which they live. We have got some who then think that because the pass rate at this school is so low, why should I continue being in school, and yet I can easily get married and then have a husband who will take care of me. Mm-hmm. That's one. We've got other girls who are affected because of the religious denomination under which they follow, or in fact under which their parents follow. Mm-hmm. And where they've got doctrines that say it is not worth it to educate a girl child, and by the time that girl child is grade 7, they do not bother to send a girl child to secondary school. They believe that transition is not necessary. That girl is then being prepared to be given away as a wife to some older man with several other wives. So these are some of the issues that we are facing. And it is always our clarion call as the Ministry of Primary and Secondary Education that this is probably not our ministry problem per se. It's an all hands on deck problem where we have to find solutions as all stakeholders. I'm glad that we've got a panelists within the studio that are from various organizations that are working towards empowering the girl child so that they are not easily swayed into falling into the trap of sexual abuse. We are doing our part, and what I can guarantee you is the school system itself, the school environment is very safe for the girl child. When a girl child is out of school, the risks multiply 10, 12 times of her falling into the wrong hands or her being abused. So this is why we try and keep the girl children as much as we can in the school system. We are looking also at rural areas where this is also very rampant. It is rampant mainly because sometimes the girl child has to walk a long distance to school, 5-10 kilometers. During the transition of walking to school or walking from school, they encounter pedophiles or they encounter some men who may think that they may be able to take this one as a wife or just to abuse that girl. This is why one of our strategies is to ensure that we've got low-cost and sustainable boarding facilities within rural areas. And because of those low-cost and sustainable boarding facilities that we are offering, which are headed by matrons who are elderly matrons who make sure that those girls are under lock and key, we've managed to prevent and avert a lot of girls falling pregnant. So there are a lot of strategies that we are putting in place because we have realized that this is a very big problem. But the protection that we can offer as the Ministry of Primary and Secondary Education, and it remains also a clarion call to all parents that if you have a girl child, if you really want her to be safe, keep her in the school system. It is even better to place her in a boarding facility when she goes into secondary school, because there we're able to monitor 24/7 the behaviors and the attitudes of those girls. Obviously, we may not have enough boarding schools. This is why the Second Republic is on an all-out drive to construct various number of boarding schools throughout the country. This system will be able to protect our girl children from falling pregnant or from early marriages, because in the school system itself, it is the cases are there where a pupil and then a pupil may engage and then the girl falls pregnant. Or in some other cases, a staff member, and I'm not just talking of a teacher, I'm talking of even ancillary staff members, may be seen to engage in these girls. But those cases, we really nip them in the bud because we have got punitive measures against that. Any civil servant who is found to have violated an underage girl is dismissed and discharged and is never allowed into the public service system until they leave this earth.
Now, Tongana, thank you so much for your contribution. Really appreciate it. So now, in the short period, I won't call it short because time really does move fast, but in the time that we've sat here and spoken about this, we've really unraveled a whole can of worms, I'd like to call it. We've opened it up to say this is what's causing teenage pregnancies, and these are the interventions that you guys in your respective capabilities have put in place in order to fight it. Now, we're talking about what you have been doing. The UNFPA, I understand, is also involved in offering sexual reproductive health education to those that do need it. In as much as we are doing so, why do you think it fails to work?
Actually, thank you so much for that question. I want to also appreciate the Ministry of Primary and Secondary Education on what he has talked about. It's a total collective approach, stakeholder approach, and I think there's a partnership that we are all coming together to have in place, a national framework to address teenage pregnancy, inter-ministerial and even partnership framework, where we're going to be looking at the different areas that the girl child is affected in her health, in the economic aspect, and then on the basis of that, the partners will now come together to implement that framework. And the government already has the policies in place, because with the policies, we need to implement the policies from policy to action. So that's what we want to really focus on now. Coming to your question in terms of the awareness raising or the information you're talking about, That's why I was saying that I wish we also had the Ministry of Health here. We work with the ministries and the different partners to ensure that these young people, the girl child, has the information that they need when it comes to reproductive health services. Because we have the services. When the girl child goes to the facilities, the health facilities, the services are there. We have the health workers who are there. We'll give them according to their needs and their choices. Jimmy talked about age-appropriate information and the CSE. Yeah, age-appropriate. So it means that the information that we have there is across the board and the different age group. We hear that our young girls are having information from the internet. So on the basis of that, when we give that information, we need to follow through that information. We need to follow that information. So we cannot say that it's not working. We're saying that whatever we have been doing, we should scale that up. Now that we have the statistics, we now have even at the sub-national level, we should scale up and bring all the partners together. The parents, you see, we should rethink the parenting. Can we have dialogues bringing the parents together, intergenerational dialogues, where the parents sit, the teachers sit, even the child? Why should it be a taboo for us to talk about sexuality,
I think
education
that's
issues?
also something that Jimmy was
Exactly.
saying.
With our parents at
Refocusing our
home.
parenting on
Yeah.
why are we making it taboo to talk about sexual reproductive health
At
when
home.
it is something that is really affecting
Exactly.
our children at the end of the
It
day?
is affecting our children at the end of the day. We can start from home and talk about it.
And put it into
and
the
put
education
it, yes,
system.
as the child goes to school, they have already been grounded at home with the information, that equipped with the knowledge that as you are growing, because the subjects are there, when they say, what do you say, comprehensive sexuality education? It's at the basic subjects that we do in school. Some schools call it human biology. Some call it biology. Some call it life skills. So it's as if the words themselves, we are afraid to even pronounce the words. But the children go and learn about this on the internet, from their peers. Peer pressure is everywhere. So why can't we as parents at home give that foundational knowledge and information? And then as our children go to school, we are there with the teachers who are well trained, capacitated, and then when they go to the health facilities, we have the health service providers, the social workers who are giving them the information. So it's a collective approach to address this teenage pregnancy issue.
Now, Jimmy, you are a gentleman, of course. I'm not going to gender stereotype you, but when this education is put out, and you say what in your capacity, when you go out and educate teenagers on teenage pregnancies, are you only focusing on the girl child, or are you also focusing on the boy child? Because like Tankana was saying, sometimes it's the peer-to-peer pregnancies that's happening. Are the boys also aware that they are also part of this entire situation?
Yeah, from a SEWAT perspective, we engage both males and females. We work with both boys and girls. We actually have a cohort of what we call Mugota. This Mugota is just, we take it from our cultural meaning, the cultural concept where Mugota, where boys who are not yet married sleep. So we've got a platform that we call Mugota. This is where young boys meet and discuss issues to do with their sexual and reproductive health. And more importantly, we've got what we call the Web for Life, where we also make use of the sister to sister, whereby the students who are in the tertiary institutions, teacher training colleges, who are learning to be teachers, when they go on teaching practice, they are trained also to engage with the female learners, the girls, and teach them about sexual and reproductive health. Of course, following the guidelines that are given around the age-appropriate sexual and reproductive health, the comprehensive sexuality education teachings that are accepted, which I was saying that there is need for us to intensify that. More importantly, as what we are looking at public health from a non-clinical perspective. We generate demand by providing appropriate information to these young learners for them to go to know where they can access the information or maybe the services that they might require. But at the same time, we are faced with some limitations in terms of the existing laws, where at what age can a young person, can a learner go and access what services from a clinic without the presence of the guardian.
And I'm sure that's still a matter that is still being discussed, and it's still such a sore point, so
there
to
is
speak.
no consensus yet, simply because there is a whole lot of fears around liberalizing it. I feel strongly that as a country, we are a fake conservative society. We are a fake conservative society in the sense that we at one point desire to not to speak about certain things, but in reality we actually even agree and appreciate that it's happening. We heard about what is happening in Matebelem, that oh, you guys, you are surprised about these headlines. We knew about it, we were talking about it. So that's how again a fake conservative society can lead us into, whereby you run away from the reality, try to run away from the reality and start looking at things from another angle. So basically, us as what we are contributing to ensure that we increase the risk perception of the learners.
I hear what you are doing from your end now. Mucha, you have heard we're talking about the education of adolescents, about teenage pregnancies, contraceptive methods that the UNFPA does, as well as, what SAYWAT is also doing. I want you to weigh in on this entire discussion. What is your take in regards to educating the children about sexual and reproductive health?
So I would say under Women's Coalition, which is a coalition of many women's rights organizations, we have some of our members who have implemented some concepts like the Nanga, which resonates with the Gota.
So the opposite.
Yes. Yeah.
Okay.
So that Nanga concept is being implemented where girls are taught on the ways in which they behave and encouraging them to reach their full potential. We also have other organizations under Women's Coalition that are also focusing on the girl child. And we don't exclude the boy child though, but because of the pregnancies, we then focus on working towards the girls reaching their full potential. So this is a crisis which needs everybody and all hands on the deck, but we need to unlearn certain things that we learned as a society, where the unspoken word is to be spoken. We need to package even learning materials where parents at home can discuss any topic on sexuality with their children using the age appropriate. I think this is what psychologists suggest.
Right.
We also need to break those barriers where sometimes we don't talk about it, we don't mention these things. Even if a girl child has to have menses, it's not discussed in the home. They need sanitary pads, it's not discussed in the home. Yet the child will be going through a lot. So we need to focus on how can we break those existing barriers, which then makes it very difficult for the girl child to open up to their parents, because the parents come in heavy-handed with all these rules and regulations, with the way that they reprimand. The girl child is not comfortable to discuss with their parents on what they are going through, which means even if they face any abuse, they face it quietly. And then there's also a need where we need to look into some religious sects that give away the girl child as a way of marriage, underage even, ignoring even the laws that are already existing. So we need also to educate, we need to disseminate, we need even you on media to talk about it loud and clear to our communities in vernacular even more, because right now we're having this discussion in English, and which means even communities that are watching may not be even understanding what's going on. We need also go down there to the root. In Matebeleland North, they speak English, so they speak Ndebele, they speak Nambia, they speak Tonga. We also need to get into their languages and ensure we leave no one and no place behind. Translating, have these conversations where we have parent, child, and teacher communication. This comes also with resources, because I'm sure even Jimmy, as she is talking about it, they are not covering the entire country due to limited funding. So we need the government to roll this out, working with partners in all the 10 provinces, mapping to see who's doing what. As Women's Coalition, fortunately, we operate in all the 10 provinces of Zimbabwe, and we have our members across the 10 provinces. We need to also work together so that at least the voice is heard, and we then change the way of doing things. Because like I said, whether we like it or not, the reality or the ground, this is happening. So this is a rude awakening. If we have 21,000 in a space of a few months, few years, this is scary. And like I said, this is reported cases, how about those that go unreported?
Yeah, like Sfe was saying, we have cases that do go unreported.
Yes.
Maybe other children who are aborting in their homes and no one gets to know about it.
Yeah.
Speaking of which, Sfe, from your end, we have discussed who might be the perpetrator. We have touched in bits and pieces that who might be the perpetrators of religious sects, pedophiles, like was mentioned. We also have maybe peer-to-peer pregnancies. But from your end and from your lens, who really are the major contributors to teenage pregnancies? Which demographic are we looking at, Sfe?
All right, thank you for the question. For Mat North, I can speak for Mat North. We have the A8 highway, which is the highway from Victoria Falls to Bulawayo. It's a highway that carries a lot of mining equipment, a lot of mining goods, a lot of trucking companies. So we have multiple truck stops along the Victoria Falls to Bulawayo highway. So meaning that there is a ready market for young viral women by these truck drivers. So we've got a truck stop in Victoria Falls, a truck stop in Wange, a truck stop all the way in Mguza up to Bulawayo, some formal and informal. So a lot of young people are being used by these truckers. Then we also have artisanal miners who are basically casual workers who are coming into mine in the different districts of Mat North. You're talking about Wange, you're talking about Umguza and all those areas. So these contribute to the high rate of pregnancies. Then, of course, because we are in a place where we are between Botswana, Namibia, South Africa, and Zambia, you have parents leaving their children to search for greener pastures unattended, unsupervised. So you find within the local community, they know that there are these kids who don't have anyone taking care of them or supervising them. So they become very vulnerable to abuse. So these are some of the situations that are creating the high rates of pregnancy we have in Mat North. And like the speaker said from the Ministry of Education, we have a lot of unschooled young people in Mat North. Our rate of penetration in terms of our education levels and taking in the availability of education is very low and is poor. So you have girls dropping out of school at grade 7 or at Form 2. So they don't have any cover per se. So they become vulnerable. And because our terrain as Mat North, we don't have too many economic activities, and there's drought and the soil is not good. So you find that the economic situation is really playing a heavy burden on the young people. So they are open to transactional sex. They want to eat. They want to survive. They want pads. They want cosmetics. So they are literal fodder for anybody who wants to take advantage of them. Those are the multiple perpetrators within our communities and the whole spectrum of Mat North.
Now, so my next question now would be, we already know that these are the perpetrators and these are the areas where they are found. While we might not be able to control what which child is going to be doing, are we then doing enough to educate them, give them contraceptives if need be, or protection from to make sure that they do not get pregnant in the act? I mean, you can't really control what the children are going to do at the end of the day, but I'm sure we can help them in learning how to prevent themselves or protect themselves from such circumstances.
All right. For us as Rise and Shine Trust, for the last 8 years, we've been having what are called girls' clubs. We meet with the girls every Saturday at different locations according to the resources that we have. So we've been doing this for the last 8 years, and it works. It works, but you find you can only do so much in any space, because I find a lot of national programs, they work from the top and sort of like exclude grassroots organizations, and I'm glad that we have a representative from the UNFP. We as grassroots organizations are saying don't exclude us out from the fray of working with communities, because we are on the ground. We can deliver the messaging better and more. Of course, at the national level, it works, but we need to be engaging more and more with grassroots, small grassroots organizations, these small trusts that are located in most of the parts of the country. They are important in terms of making sure that we have the right messaging. And part of the right messaging is saying, let's not bury our heads in the sand and say it's just a girl problem. We have a problem with the young men. They need to be taught. We need to talk to the elders in the communities, the chiefs, the village heads. Let's all come together and dialogue and begin to say, look, we've got a crisis, we've got a problem. If we don't deal with it, I'm telling you, we will not have, especially in Mat North, there'll be no girls going from grade 7 to Form 1, Form 2, because all of them will get pregnant along the way. That's the honest truth.
Well, another hot take we're getting right there from Sfe, like I did say, our time is moving pretty quickly. So I'll just really like to kindly ask my guests here to keep our response a bit short so that we are able to discuss as much as we can in the short amount of time that we have. Tangana, I want to come to you now. Sfe has made some, has raised some concerns about the education penetration in Mat North. What is your take in regards to that?
The education penetration in Mat North?
Yes, that one.
Yes, in Mat North, we have got quite a number of schools in Matabeleland North. Our challenge is that we do not seem to have many of the children going to school. Some of the schools that we have in Mat North, you can get there and there is a teacher-pupil ratio of 1:12, 1:15. Well, there are various reasons that could have caused some of the girls not to come to school or the pupils. And key amongst them could be the distances that they walk. But coupled with that, we have noticed that in Mat North, especially close to the border with Botswana, we have a lot of our children who cross over to the neighboring countries because of economic hardships which their parents may be facing. And so their parents may not be able to send their children to school. By sending them to school is almost like a privilege, because at home they are not able to live on a day-to-day basis, providing fully for the family. So once a girl or a boy comes of age, they start to think that I can at least assist my parents by looking after myself. So the boy child may go into artisanal mining. There's also the issue, I think, the business of sand, carrying whether it's river sand, pit sand, with those trucks, and leaving school. Because here they know if they go to work there, they'll get $1 or they'll get $2, $5, $10, depending. And these are the very same boys who will be turning into men. The very same boys who will be turning into men who will go after these girls. And also show to those girls that it's better for you to come and be my wife than for you to continue going to school, because I can take care of you. So these are, but it's not really unique to Matabeleland North. You can find these same circumstances I'm talking about in areas such as Mbire, Rushinga, Mbudzi, I'm not Mudzi, not Mbudzi, Mudzi, Uzumba Maraba Pungwe, UMP, and other outlying border areas. This problem is rampant. It may be a little bit more pronounced in Matabeleland North, because it seems like Mat North, this is where most of our partners like to go. So they collect that evidence. But if they go to Mashonaland and Central, they'll see the same. Mash West, they'll see the same. They go to Mash East in the border-like areas, though. Manicaland, they'll see the same. But our partners have concentrated themselves mainly in Matabeleland North.
No, Tongana,
Miranda
is disputing that claim.
No, we have not concentrated there. You know, the DHS did subnational analysis. It is across the nation. But where we are talking about marginal, because that is where it's more rampant. The percentage there is higher than in other provinces. I wanted to clarify that.
Okay.
So, but the analysis that he has given, as well as our colleague on the ground, is very important in terms of us focusing on a kind of localization strategy to use that to engage more with the community, the grassroots organization, to be able to raise that awareness and have that intergenerational dialogue from the village heads, the parents, the girl child themselves, the young people, and then you see the youth ministry also comes in, because we say it's a total, a multi-sectoral approach. Most of these young people that are youth, and we have a ministry of youth, and we have to actually empower them. You know, that's why we have to talk about the youth economic empowerment, and the ministry of youth should also play a role. So it's a total stakeholder, multi-sectoral approach for us to be working together to address the issues that has been raised.
Now, in the 14 minutes that we do have left, I want us to talk about what your take in providing contraceptives or protection in schools. What do you think about that? Because most have come to say if you do that, then you're encouraging bad behavior. But then again, it is us ignoring this bad behavior that leads us to talking about situations like this. I'll start with you, Jimmy. Providing contraceptions or protection in schools. What's your take?
I touched on this earlier on when I brought in the aspect of the failure of parents and authorities to agree on comprehensive sexuality education and the issue of provision of these condoms. At the same time, I may want to bring to your attention the limitations that some of these things might have, especially when you are looking at the age at which a learner can be able to access condoms or any of these contraceptives. I'm sure there is a bill that is being discussed in Parliament, the Medical Services Bill. So if that act is revised, there might be need to, there might be a provision that enables a learner to go and access SRHR, sexual and reproductive health services, without the consent or without going with a guardian. So the provision of contraceptives, as you may be suggesting, within the colleges or within the schools where teenagers are found, has got a lot of limitations. There is no point of convergence between parents and the authorities. For on this one, it's not about the authorities alone. Even the parents themselves, they've got a problem. Once they hear that you are talking about comprehensive sexuality education, they're going to be hullabalooing within the country. So there is need to have that point of convergence where parents get to understand, move away from that fake conservative society that I spoke about, and face reality on what is happening. Then from there, we can be able to begin to deal with these symptoms that we are faced with now.
Mucha, your take?
I agree with Jimmy, because the way we were raised in our generation is different from what we have. Information, and they have also a lot of interactions that they do online and even out of line. But what we need to do is that we may need to start maybe with our leaders themselves, because they are community popular opinion leaders within our communities that drive people together. These are the people that we need to educate first, and then we go through to the parent after having started it from the leadership, the gatekeepers themselves, because it's our culture where we expect purity from the girl child, but we don't expect that same purity from the boy child. And in the end, you would see that most of these things are tilting towards the girl child, because this is where the noise is coming from. Any man would want to marry a virgin, but then all these men, they go around breaking the virginity of the young girls. So this is also our concern, to say, as we as coalition, we are worried that we are only focusing on maybe sex work or prostitution among the girl child, but who are they prostituting with? We also have the older men who are going for younger girls, some of them impregnating them, giving them STIs, and the new HIV prevalence even, it's higher among the adolescent girls, and also in marriages, because in marriages, the older men will not use protection. Yet with younger girls, because of their vulnerability, we didn't touch even of those young girls, young women in tertiary institution, where the tertiary institution is expanded, but its accommodation is not there. That also gives that girl child vulnerabilities where they then are lured by what they call the blessers, who then abuse them, and in turn there's transactional sex that is going on. So there is a lot we need to also come to terms with. And I know it's not a very good topic to discuss, but we have to discuss it, to find a way.
The uncomfortable topic that you're not talking about, that we have to start having.
Some way, somehow.
Now, I want to come to you, Sfe and Tongana. Just real quickly, I want you to weigh in on this. Our time, and I do not know why it seems to be running out so quickly, but I want you to just weigh in on this. The provision of birth control services or condoms to school children. What do you think about that? I'll start with you, Sfe.
Okay, thank you so much.
Tongana. Okay, you can go ahead, Tongana.
All right. Thank you so much for our policy position as the Ministry of Primary and Secondary Education and as government. We do not offer contraceptives in our schools. We will not give the control pill in our schools. We will not distribute condoms in our schools. What we will do and what we have continued to do is to provide the appropriate education of how to use contraceptives, or why contraceptives need to be used. And the teachers may even demonstrate how the contraceptives are used in the classroom, obviously using props to say this is what happens when this contraception is used.
I'm sorry, I have to just jump in before you go further in your response. Why are you not offering them? Because from what the discussion that we're having here is, the education is there. They are being taught, the school children are being taught on what to do and what not to do. But now, because you really cannot control what they can do and what they cannot do you not think it's now time for you to just say, you know what, we have given you the education, we're also going to help you prevent in case you decide to go ahead and do what you have to do? Why do you not want to provide the birth control or the protection in the schools?
Thank you so much. Let me just be very convenient with with advising you that in the school system we are not we do not have a management or administration that says it cannot control what a child can do and what a child cannot do. Otherwise, would lose it. We, in the Ministry of Primary and Secondary Education, can control what a child can do and what a child cannot do. And what we are saying is we are not going to give you condoms, we are not going to give you birth control pills. That's how we're going to control it, but we are going to give you that education. If your parents back home are comfortable with giving you condoms, then that blame should be on the parents or the community. But within the school system, we are not going to distribute condoms or birth control pills. That for us would look like it's an encouragement of them to involve themselves in sexual activities. So we can control it. And we, by saying we are not giving them condoms or contraceptives, we will not be indulging in those activities. In fact, it is very difficult for our pupils to indulge in teenage sex within our schools. If they are lucky, they will be very unlucky on the second attempt.
Okay.
And we normally either cancel them or we would exclude them if they are repeat offenders.
Okay, Tongana, thank you for that contribution. I want to bring it back into studio. I saw your face take. I want you to weigh in on that. 5 minutes now left, but I'm sure it's enough time for you to give me your thoughts. I'll start here with you, Mocha.
So what I wanted is to agree here, even not as panelists, but as a country. If we have these alarming rates and of statistics that we have of what's going on, the ministry need to relook into the policies and avail when in some toilets we see condoms. They should be available even in school toilets as well. Same as the sanitary pad alongside, because these are the realities on the ground. We give information, but we also provide the services. Same applies, the Ministry of Health should also have youth-friendly services that are practical, that are there. We talk about youth-friendly services, but they're not there. A woman would frown to a younger girl who can approach to say they need these services. So we need also to school the health service providers who provide these services so that the girl child can freely walk in without a guardian
and
and access the
services.
service.
Miranda, your take?
Yes, actually, do we really know the age of sexual debut of the girl child or the young person in the country?
Yeah. Below 15?
Below 15.
Yes.
Okay. We applaud the government for actually adopting and raising the age of consent to 18 years for marriage. But the age of sexual debut is below 15.
Yeah.
So to the comment or the submission I would like to make here is that it's a policy issue. We should have to look at it. We'll look at the policy. We use the evidence that is warranting us to talk about it. Look at our legislation. Is the current legislation working and addressing the needs of our young people, the future generation, our young girls who have to live and fulfill their potential? Then we come to the table and look at it. That generation that we want to live to that vision of an upper middle income country, is that the kind of generation? I don't think so. So it's good to look at the policy issues where there are gaps. Collectively, we sit and discuss them and make recommendations and make the changes that are appropriate within the current dispensation.
Now,
Okay?
Sfe, I'm not sure if you're online or we lost you there for a bit, but I'm sure you did hear the contributions that have been made. Just quickly before we now close, because I would like to come back to Jimmy in studio before we do conclude, what is your take on this?
Tell you what, I think we need to call a spade a spade. We've got a problem in the country. And we need to relook our policies, relook how we've been doing our things, and come together and sit on the table. Like Jimmy says, let's not be fake conservatives. We've got a problem. What are we going to do about that problem? Because if we don't nip it in the bud, it's going to continue. So parents have to talk to their kids. The Ministry of Education has to relook and say, what can be done at a school level? What can be done at a ministry level in terms of educating and making young people have access to contraceptives and things like that. At the beginning, when I started my girls' clubs, I used to talk about abstinence. But after spending years with girls and young men talking to them, you begin to think, oh my God, they are doing this every day like they are married. So we need to change our conversation. That's my thinking. We need to change our narrative and how we're looking at it.
Now, Jimmy, your minute is, it's now your time, your 1 minute to contribute to this conversation as we conclude.
Well, there is what is ideal for our young learners, our teenagers. There is what is ideal. There is what is desired of them. And there is what is real. So the reality is what the statistics is telling us. So the policies must be informed by the realities. So we might now need to revisit our policies informed by the realities and realign our policies. We can't continuously be stuck with the ideal that is no longer in existence. So I think we are stuck in the past. We are stuck in what is desired. We are stuck in what might be ideal, but ignoring the reality. So we now need to realign our policies with what is real and rethink, finding a point of convergence between the parents, various stakeholders, and the policymakers led by the media yourselves, whereby you now need to continuously increase and increase the information dissemination and properly breaking that silence on those hot topics.
Now, Tangana, thank you so much for joining us. I do not know if you're still online. Say thank you so much for joining us via Zoom.
You're welcome. You're welcome. Thank you very much.
Well, time really does move fast when you're having very insightful conversations. In studio today, I was joined by Miranda Tabifo, Country Representative, United Nations Population Fund, Mocham Kamuri, Chairperson, Women's Coalition of Zimbabwe, Jimmy Wolford, Executive Director, Say What. Joining us via the phone was Songa Nandoro, Director of Communications and Advocacy from the Ministry of Education. And we also had joining us via Zoom, Sfe Sevata, Project Coordinator, Rise and Shine Trust, based in Matabeleland North. I have been your host, Faith Nyauden. This has been The Case. Good evening and pleasant viewing.
On this week's episode of C'est La Vie, we meet Jolene, a fiery creative who shares her journey as an interior designer. We then end the episode off with a private culinary lesson from Chef Tyler Sibindi, where we learn to make various tasty dishes like carbonara, whose pasta you'll learn to make from scratch. So get your cooking gloves on and your notepads ready. This episode is sure to be the ultimate treat. Only on C'est La Vie.
Hi, I'm Joey, and I'm an interior designer, and I'm here to break the mold. I'm a passion-driven, up-and-coming interior designer, so it's someone to look out for. I'm a very spiritual person. I feel like my journey has been God leading me, guiding me every step of the way. What led me into the interior design field? I'd have to say it was my family. I think I've always had a passion for it, but it was having a lot of family members tell me over and over again that I should do this as a business, I should do this, I should start this, I should do the course. So they were actually my driving force into starting my course, into starting my interior design course and my company. So my journey as an interior designer started, I had a couple of friends that approached me to do some work for them. And while I was doing that work for my friends, I started recording and started taking pictures and documenting that process. So in doing so, I decided to do the course, and I started with the New York Institute of Art and Design. And I'd done the course, and it took me about a year or two to do the course. And while I was doing the course, my popularity grew. I started posting the stuff I was doing, the work I was doing on Instagram, on social media, and that's how my popularity grew. And then I opened up a showroom in Kwekwe, where I'm based. And since then, I'm working on opening a showroom in Bulawayo, in Kumalo, Ascot. I will be opening another showroom in Borodale and another showroom in Pomona, Harare. So yeah, look out for me. There's a lot coming from Joey's Deco. How long have I been in the field for? So since I've done my course, it's been 4 years, and I started my interior design firm in Kwekwe. It's been less than a year, actually. In my opinion, I don't really think Zimbabweans appreciate the art of interior design. And I'll tell you why I say that. I don't think the economy allows us Zimbabweans to quite enjoy it, because I feel like if we had the money, then why not? Why wouldn't we change our curtains every now and then? Why wouldn't we change our headboards or do the wallpaper on the wall, you know? So I feel like the economy really affects Zimbabweans in that sense. The most common interior design trend I despise would have to be the ceilings. I don't know if you guys have seen these ceilings that people are doing these days, and I'm not a fan, hey? I feel like a ceiling should be seamless, you know? Ceiling shouldn't have all these things protruding out, you know? I don't know. That for me has been something that I find very hard to adjust to, so I would do away with that. How I would best describe my style? I would say my style is modern, contemporary, with a touch of simplicity and sophistication. To be honest with you, I don't follow a certain trend. I just go with what I feel works in a space. So to say I actually follow a trend, I'd be lying to you. I really don't. The difference between residential properties and commercial properties is a residential property has to be you. It has to be you in the space. It has to reflect you. So it's your personal touch. Whereas if I'm designing for a commercial space, a hotel, it has to be something that speaks to everyone. My favorite design project that I've done would have to be Tinashe Mtaris's office. Why that is? Because it was the first biggest project I've ever worked on, and I feel like he gave me free rein to showcase my talent, and the colors and the pieces of art that I used, that was all a reflection of my work. So I feel like that best represented Joey's Deco. A recent project I've worked on and the lessons I've learned would have to be a recent client that I did in Kwekwe. It was a project I did from the beginning. So they literally bought a house, and it was a peasy house. It was falling apart. They bought the house and they called me in, and I've been involved in that project from the beginning up until now, up until its completion. And why I loved working on that project and the lessons I've learned from that project is another business idea came from that project. So from that, I've gone into flipping houses. So that was actually my biggest inspiration while I was doing that project. So apart from interior design, yes, I have a number of companies that I'm working on, a number of projects that I'm working on. When it comes to interiors, you're constantly being creative. So one of the businesses I've entered into now is doing events. So I've got a little company that I'm starting up, events. It's going to be called In the Details. Challenges I faced in the industry, I must say I never really felt support from other interior designers. I wish we would all come together as Zimbabweans as interior designers and inspire, and I'd love to remove the word compete and I'd rather use the word let's inspire and encourage each other. So for me, that's something that I'd love to see us Zimbabweans come together in the interior design world. My advice to upcoming designers, I would say if you have the passion for it, go for it. Don't give up. You know, it's not an easy road. You'll come across challenges as with anything. So I feel like if you have the passion, find a course, study or mentor, get somebody to mentor you, read up on it, do as much research as you can, but go for it. Don't give up. I'm 39 years old this year, and you could say it was too late for me too, but I've started and here I am today. So my favorite motivational quote has to come from my adopted grandfather, Steve Harvey. I say that because there's so much that he always says that inspires me. But the biggest one is you have not because you ask not. And that for me has been the catalyst where I am today. I live by that. So I've been asking. I haven't stopped asking. Future projects to look out for. Joey's Deco is going to be doing a TV show. So that's something to look out for, focusing on the interior design world of Zimbabwe. And I will collaborate with other interior designers as well. Like I said, let's inspire. Let's not compete with each other. Interior designers locally that inspire me would be Elite. I'm inspired by a woman that can focus not only on just design, but she's got an in-house manufacturing company, and I really love her style. So that's been quite an inspiration. I'm yet to meet her. We have not met, but I will do so soon. And you can catch me again right here on C'est la Vie.
On this episode of C'est la Vie, I am joined by Chef Tyler Sibindi, who's going to teach us how we can make some of his cool meals from the comfort of our homes. Welcome, Chef Tyler.
Thank you, Margie. So today we're going to do a 3-course meal. Very simple, straightforward, and you can easily make this within a day's work. The ingredients are not too hectic, so you can kind of also play around with the flavors if you want. So to start with, I've got some pork belly here. Some nice flavors that come from pork belly, and we've got some different seasonings here that I'm going to ask you to help me with in preparing this. First of all, we're going to create a dry rub here using some coriander seeds, some paprika, some garlic powder, some black pepper, and some brown sugar. We're also going to add a little bit of salt in there too, just to bring out the flavor. And then from there we're going to cook it 2 ways, low and slow, and then on very high heat and very quick. So for our spices, any dry spice really, first of all what you want to do is toast them. So we've got some coriander seeds and black pepper. It's a little bit of spiciness from the black pepper, and the coriander seeds add a nice fragrance to it. So I'm going to ask you to add that to our pan over here.
Okay, no butter, no nothing, just
no butter, just
toasting them.
Just toasting. That's
all
what we
of
want
them.
to do. Yes.
That looks pretty. That looks like a little hard actually.
Right. So with any spice, to turn it into a powder like this, you want to start by toasting it. Now, spices contain just like really tiny particles of oil, which really bring out like the flavor, and it makes it also easier to crush when we mix it together with the rest of our spices there. So here I have got my pork belly. So you can get this from any local butchery. So basically what we want to be able to do is, a lot of that is fat. So we want to be able to cook it in such a way that the fat exit out and we're left with a nice crispy pork skin. One way I like to test my knives is just like sort of holding the blade there. I'm not really afraid of like cutting myself because I've done that enough times. But you want to make sure that your knife is sharp. A sharp knife is the safest knife. Okay, so you see my knife is not as sharp. But also one way that you can sort of fix this is you could also use a razor, you could use a Stanley blade, but a sharp knife is what works. So here we go. You've got your pork scored, so it's going to make it easier for us to sort of slice through. And then from here, we want to then season this part with our spice blend. All right, so for our spice blend, Marjorie, I'm going to just ask you to mix everything together into here. So
this is
your paprika. Then your brown sugar. And then from there, your garlic powder. So obviously, if you want to play around with different spices, you can totally play around with different spices there. So I'm just going to ask you just to mix that together. Pork has a lot of fat, and fat in many cases is used to sort of like tone down some flavors. So if you got something that's like very sour, you can use some kind of fat to just like help tone down that sourness. So the part that we're more concerned about is the meat section here, so we want to season it heavily. And then through scoring what we did there, a lot of fat is going to exit through there. So there's going to be a lot of moisture, and you'll see that there's going to be a lot of moisture loss there. So from there, you want to just pour a generous amount on top.
I'm supposed to continue?
Yep, you can go. Yeah, I think that's fine. Right, so then from there you want to get your hands in there, just like massage it.
Oh, to massage it?
Yes.
Here's a back massage base before we fry you up.
The pigs had a long day and
Yeah.
took a lot getting here, so
You just will beat this up into
right, so now we're ready for the flipping. Exactly.
So this is the one that's going to be on the bottom.
Yeah, so the seasoned side is going to be on the bottom. So I'm just making sure. There we go. Don't worry about that. So this is the trick. So like I mentioned, we want to be able to salt this point here, but we don't want that salt to go to the bottom. So what we're going to do is just going to take our foil paper, and then you want to create sort of like a boundary around the pork. The more secure, the better. You want to make sure it's all the way to the edge, because we do not want not even a single bit of salt to go
on top
at the bottom where we've seasoned. So we want to, like I mentioned, we want to dry the skin. So what's going to help is salt. Salt pulls moisture, which is which we want to do for a nice crackly skin. You know, you could go and buy a beef roast and use almost the same principle, you know, low and slow, and then, you know, cooking at high heat the same way we're going to do it. You can use the same sort of seasoning, yeah, like it works just the same way. I think this method here is tried and trusted. I think you know that. I don't know if you have the same similar experience where like you cook, you make food, and your mom or your dad or your grandfather likes to season before actually tasting. Yeah. So yeah, so a lot of people actually, you know, it shows that a lot of people like salt in Zimbabwe. So I'm pretty sure they're gonna like this. So to try this, we want to add.
If the health council or the health board comes for you for this, the salt is terrible.
Right, I'm not gonna be around. That's how I like to say it is you want to add a blood pressure amount of salt. But don't worry. Right, so you don't have to worry about it emptying too much. You're gonna just sort of flatten it through here.
So that crackling that they sell in stores, like just a dry one, this is what's happened to it.
So there's other ways of doing this. Is you could also like pre-cook the like the skin. Like if you remove the skin, you like boil it, and then from there put it in, let it dry out, and you can fry it in oil or throw it in the oven. That's how it comes together. Right, so this goes in the oven at 180 for about an hour, and then from there we'll take it out and then cook it for an extra 20 minutes on very high heat. What we're gonna do is we wanna make pasta from scratch. So a lot of people think it's very difficult, but it's actually very simple. There's only 2 ingredients. You need your flour and eggs. We want to add in just a little bit of oil. So this is gonna help with just the general texture of our pasta dough. So we're gonna whisk this while we're gradually gonna start adding our flour. Now this dough is gonna be different from a lot of doughs. If you've probably made bread, this is gonna be like a very firm sort of dough. That's because the egg adds an extra amount of protein, which makes it a lot firmer. This helps with the chew of pasta that we're normally used to. I will say though that the store-bought pasta is very different from this one. You can simply make, if you look at the back of your packaging on your pasta or your spaghetti, whatever it is that you like, it's normally just flour and water. What we're doing here is using most of our hands just to bring it together.
Okay.
Yeah, it's like, if the dough feels a little bit hard, you can always add in a little bit of water. So it starts off a bit crumbly, but then we basically want to just start kneading this together. Flour normally contains gluten. Gluten is what is responsible for giving any flour product structure. Like gluten is kind of like muscles almost, because you have to work it. And then when your dough is sort of smooth, then that shows that your gluten has developed. And just like muscles, you need to also let it rest. You want to use mostly the heel, because I think that's where a lot of strength is.
Boss. So I was even like, why are you doing this? Dosaga, this item is yo. Okay. Chef Tyler Bo.
Just let me know when you want to tap out.
And
you're done.
When you're making donuts, when you're making all of that dough is soft.
It's soft.
So please don't think that like I'm a wuss. I'm removing my gloves. So what else do you like about cooking? Like what are some of the things that you've learned in the kitchen that you can use as a life skill?
Well, I learned to aim for progress and not perfection. And that's an important lesson that I've
If at first you
learned.
don't succeed, try again. That's just the short of it, basically.
Yeah. So, dough is
Open
done.
the fridge.
It's going to go in the fridge.
For how long?
For about 30 minutes or so. This gives us also enough time to do other things.
Let's check on our pork.
The salt kind of forms a skin, as you can see. So what we're going to do from here is that we're just going to peel off some of the salt here.
So what do you do with the remaining salt?
Well, no, you don't throw it away. The Zimbabweans will kill you. We're going to put our pork in here. And then from here, we're going to cook it for about 20 minutes or so at very high heat. So about 220, 250. And this is going to help sort of crisp up that skin and finish the rest of the cooking.
Our pasta dough has rested enough. Let's get on with our carbonara. Check out Chef Tyler's cool pasta machine. Let's move on to our duck salad.
The nice thing about cooking is like when you constantly keep doing, you constantly keep progressing. A lot of people think that like there's a ceiling to this, like if they don't do something well, and then they suck. But really, it's always just like, what I like about cooking is that you'd always reevaluate recipes and like, what did I do wrong? Maybe I didn't whisk it enough, or maybe there wasn't enough liquid. There's always something to it. So the way I like to cook duck breast has to be a little bit pink there.
So what do you like about duck?
Duck for me reminds me of beef. So this is a bird, but I mean, as you can see, like, if someone were to come and you told them it was beef, like, they'll just believe
because
it.
It looks medium.
Exactly.
It looks pink.
And I just like how duck tastes. There's a lot that you can do with just duck. There's a lot of flavor that comes from there. And it's got its own sort of very unique taste. And then I'm just gonna go in with my dressing. And then that's it.
And for dessert, our sugary sweet treat is a chocolate cheesecake with a strawberry compote. Fancy, isn't it? And the great thing is, you can be your own sous chef from the comfort of your home, as all ingredients are locally sourced and fairly easy to make if you grasped today's cooking lesson. Only on C'est La Vie.
Hi everyone, my name is Nisha and I want to make a distinction between who I am and what I do. So who I am is a daughter, and I mention that first because I honor my parents. They are my cover, and this is not only important for a young woman, but more so a young woman in the creative space. I was raised between Harare and Bulawayo in a very culturally diverse family. I'm also a mother.